Hello class, today we are going to talk about our beloved father, Charles Darwin. As you all know, Charles was a person who provided evidence supporting evolution. Before his voyage, Charles experienced heart palpitation, chest pain, and after his long journey, Charles complained having vertigo, dizziness, cramps, vomiting, bloating, tiredness, headaches, and malaise. The accurate disease was never diagnosed. Darwin died on April 19, 1882, of a heart attack, but his chronic symptoms were never explained. Many studies have tried to explain his illness. However, the most supported hypothesis is that Charles had Crohn's disease. Crohn's disease is a chronic inflammation of the intestines. This disease belongs to a group of conditions known as inflammatory bowel diseases and can affect any part of the gastrointestinal tract. Inflammation can occur, causing the formation of scar tissue of the lining of the intestine. Once scar tissue builds, the duct becomes narrowing, resulting in a difficulty for food and feces to go through the digestive tract. Genetic and environmental factors trigger the development of this illness. Environment factors include smoking, bacteria, viruses, and different substances contained in foods. This disease can affect men and women equally, and is more frequent in young adults between the ages of 15 and 35. Crohn's disease is related to chromosome 10 and chromosome 5. The IL-23R gene is associated with Crohn's disease. This gene helps the body decide how to react to certain microbes. If the gene has mutated, the body's reaction to microbes may also be different from a normal reaction. When the immune system attacks bacteria and viruses, white blood cells accumulate in the intestinal lining, causing inflammation, ulcers, and lesions. Other related illnesses to Crohn's disease include osteoporosis, arthritis, skin problems, kidney stones, eye inflammation, gallbladder stones, liver problems, and mouth inflammation. Crohn's disease can be diagnosed by different tests. The pattern of the symptoms and a family history of Crohn's disease are very important in diagnosis. Stool may be examined for signs of inflammation such as blood or white blood cells. Fever and an elevated white blood cell count in the blood may suggest inflammation somewhere in the body. Ultimately, the inflamed bowel must be visualized, which can be done by colonoscopy. When inflammation does not involve the terminal ileum, it may be necessary to capsule endoscopy to visualize the entire small intestine. For most patients, Crohn's disease is a chronic illness which flares with disease activity and remissions. Appropriate medications and occasional surgery, however, will provide a reasonable quality of life for most patients. If there is progression of the symptom of Crohn's disease, the progression usually is slow. The longer the disease is present, the more likely are complications, some of which will require surgery. In fact, surgery is required by most patients at some point in their disease. It is important to remember that Crohn's disease usually recurs after surgery, even if all visible inflammation is removed.